Even as many cases reached their conclusions, legal news on other fronts continued to pour in. As this week started drawing to a close, the Justice Department announced that another major hospital will begin providing detransitioner services to those who underwent transgender procedures as children and are now living with predictable regret. This is why we don't allow children whose brains are not fully formed to make permanent decisions of basically any kind. In fact, according to the new settlement that was reached between the healthcare giant Cleveland Clinic, the Justice Department, and the state of Ohio, the Cleveland Clinic will be allocating $2 million towards reversing as much as is possible of the transgender procedures that were done on child patients under the age of 19. That settlement was announced last week. And like the settlement with Texas Children's Hospital, it requires the Cleveland Clinic to no longer offer transgender procedures for minors, and they have agreed. They are also required to pay the federal government $300,000 and the state of Ohio $8,000 to settle the lawsuit in which that clinic is accused of falsely labeling transgender procedures in their medical billing codes. The clinic has denied all wrongdoing, but it has also settled. The Assistant Attorney General for the Civil Division of the Justice Department, Brett Shumate, said, "I am grateful that institutions like Cleveland Clinic and Texas Children's have decided to be part of the solution, not part of the problem. Cleveland Clinic's commitment to providing millions of dollars towards care for detransitioners is emblematic of just that." The detransition services that they will begin providing include medical care to balance the hormones that they effed around with, surgical revisions and reconstructions, fertility treatments for the people they sterilized, and mental health support. By the terms of the settlement that they have agreed to, the clinic must also create a website to advertise these services so that people will know that they are available for free, and they must appoint a designated care coordinator for these patients. The similar settlement that was reached with Texas Children's Hospital last month required them to create the first ever detransitioner clinic. In recent years, better and better known detransitioners such as Chloe Cole and others have also filed private lawsuits to go after the doctors who preyed on them as vulnerable children and pushed them into aggressively medicalizing their gender confusion when they were in that very vulnerable mental state, which is inexcusable. The Associate Attorney General, Stanley Woodward, stated that the Department of Justice is steadfastly committed to the protection of America's children. Just as the resolution with Texas Children's, today's resolution with Cleveland Clinic furthers that commitment and puts these providers on notice that this department will vigorously enforce federal law where children are put at risk. Meanwhile, the Justice Department itself praised the Cleveland Clinic in its announcement of the settlement, saying that the clinic had remained cooperative, proactive, and solution-driven throughout the process. The clinic told the Daily Wire that we are pleased to have worked collaboratively towards a resolution related to an unintentional coding issue involving a small number of patients. We remain focused on providing exceptional care to our patients and communities. We have complied and will continue to comply with all federal and state laws. Good for you. That's really going above board. The ACLU of Ohio said that it was deeply saddened by that agreement to help detransitioners instead of leave them out in the cold as though they count for nothing, and to stop transitioning children, even though trans procedures on children have been banned in Ohio ever since August of 2024, after a ruling from a judge finally allowed its already existing prohibition to go into effect. So yes, ACLU, it is so sad when laws are enforced instead of being empty words on a piece of paper that mean nothing. It is also so sad when the will of the people, the ones who elected the lawmakers, prevails against paid interest groups like you, and then children aren't mutilated before their brains have developed enough to fully grasp the long-term consequences, meaning their frontal lobe is still mushy. To say that you people are bizarre in the way that you view the world is the largest understatement in history. I mean, you actually want detransitioners to be denied the help they need. You don't like them, so you don't want them to get health care? Yeah, that's real inclusive. They're inconvenient to your ideological beliefs, to the ideas that you made up in your empty little heads. And so you want to exclude them from being cared for because they're not transitioners, they're detransitioners, which somehow makes them bad people. Yeah, that's so surprising that that is not the way that the people out here in the real world see it.